The tummy tuck operation is an operation where you can take some excess skin and fat from the lower abdomen. Not only taking them away, you also tighten the abdominal wall. And by tightening the abdominal wall, you create a new nice waist for the patient. It's very common, usually women who have children, and after they have children, as a result of their skin expansion, the skin do not recoil back and they end with some excess skin, which they don't like. They're actually very self-conscious about this. Some of them want to go swimming with their children, they can't do it. They would like to wear what they want, they can't do it. I'm sure you know about all the clothes nowadays. A lot of the trousers, a bit actually short waist, and it's quite difficult for them to find a good fit clothes. And once they have this operation, it changes their life. I think the most important thing you to realize that your body weight have to be steady. A lot of women, unfortunately, after having children, their body weight go up and down. Very important to have it steady so she can get the most benefit from the operation. You need to be fit, you need to be healthy. If you're a smoker, you definitely need to stop smoking. So a lot of tissue is mobilized, and if you're a smoker, because this cigarette contain nicotine, the nicotine stops the blood supply. And if it stops the blood supply and you have an operation where you mobilize tissue, unfortunately some of the tissue die away and you end with a lot of complication after surgery. I insist that all my patients have to stop smoking at least 6 weeks before any operation. And for me, it's a key for having this operation. First of all, I choose a crease in the lower abdomen, usually in the bikini line, and this is where I do my cut. The cut will look long because it starts from hip to hip, but when it's healed, you will hardly see it because also it's very well hidden in the bikini line. I raise all the skin of the abdomen, leaving the belly button attached to the abdominal wall, and then pull all the skin downward, take the excess skin, and then stitch it up. Of course, before I stitch it up, I make sure that I tighten the muscle so I create a nice waist. And for women, it makes huge difference, especially when they wear dresses, because it gives them a nicer shape. This operation is done under general anesthetic. It lasts between 2 and 2.5 hours. You usually stay in the hospital for 2 nights. When you wake up, you have 2 tubes coming out near the wound. They are named drains to collect any blood out. I use suture which dissolve on its own, no suture to be removed. All my patients also wear a very, very tight pressure garment. And the reason to do this, to allow the tissue to settle down, to reduce the swelling, and also to help them with their mobilization and protecting the muscle after I tighten the abdominal wall. Usually in the first 2 weeks, they may take it easy, but after 2 weeks, when they come back to see me in the clinic, I take all their dressing off and I leave them with no dressing at all. Between 2 to 6 weeks, they're expected to return back to full activity, and if they're doing even a very high level of sport, by 6 weeks they should be back to normal. Usually they start driving around the 2 weeks period. Any operation do carry risk. Tummy tuck it's an operation which have some risk. Some of the risk because they have a general anesthetic. Probably the only risk we need to talk about is deep vein thrombosis, which is a possibility. To try to reduce it, I make sure that all my patients have an injection to thin their blood before the operation. They wear elastic stocking all the time while they're in the hospital. We actually put some boots in their leg to pump all the blood during the operation, and we get them out and about very quickly. So from day 1, they get out and they start walking to reduce the risk. It's very small risk if you do all of this. Its operation itself do come with risk. Early on in the first few days, there is a risk of bleeding. If bleeding happens, which is quite rare, I would think it's less than 1%, this patient may need to go back to theatre to drain the blood. Infection is always a risk. Again, it's very, very rare. Unfortunately, if infection happens, sometimes wound may open up and it take a bit longer to heal. But you're absolutely right, it's more common with smoker, and this is my reason for insisting all the patient have to stop smoking before having this operation. The skin over the scar have less sensation, so older women find that the skin is less sensate, and I think it's important for them to know this. So if in a very cold night, if they decide to take a hot bottle with them, they may burn their skin because they don't have sensation. But usually sensation get better over the next few months. There will always be a long scar, but it does not matter how long is the scar, how the quality of the scar. Because the scar is in a crease line, it usually heals very nicely. But it's in the beginning, it's red in color and become pink and then become violet in color before it turns to be white. Only when it becomes white, people will not see the patient's scar. It usually takes about 18 months to 24 months for this to happen. Because this operation relies on taking quantity, it has the risk of either taking too much or taking too little. In experienced hand, it's usually worked very well. Sometimes you may have some excess skin at the end of the scar, which may need to be revised at a later stage. But again, it's very rare. One of the complications that women find a few days after the operation is that they may develop some fluid collection under their skin. It's named seroma. It's usually nothing to worry about. It's just because we created a space, the body don't like to keep a space empty, and they pour some fluid inside. It usually gets absorbed by the body within the next few weeks. Sometimes, if it becomes very tense, we can easily take it away through a needle, and it happens in the outpatient clinic, and patients do not return back to theater for this.